The HbA1c test is not just a medical measurement, it is a memory written into your blood, a quiet archive that your body carries without ever asking for permission. And this is what makes it so fascinating and meaningful. Every red blood cell in your body lives for about 3 to 4 months, traveling through arteries and veins, delivering oxygen, supporting organs, and witnessing the chemical environment you live in every single day. As these cells move through your bloodstream, glucose molecules naturally attach themselves to hemoglobin, the oxygen-carrying protein inside the red blood cells. This process is called glycation, and it happens slowly and continuously, influenced by how much sugar is present in your blood over time. HbA1c measures the percentage of hemoglobin that has glucose attached to it, which means it reflects the average blood sugar exposure over the lifespan of those red blood cells, not just a single moment in time. This is why HbA1c is often described as a long-term indicator, a kind of biological diary that records patterns rather than events. If you had a stressful day or ate a sweet meal, your blood sugar might spike temporarily, but that spike fades. HbA1c does not overreact to these short-term changes. Instead, it listens patiently to the rhythm of your life, capturing whether high sugar levels are occasional visitors or pastian companions. In a way, it transforms time into data, turning weeks and months of living into a single number that speaks quietly but honestly. There is something almost poetic in this process. Your body, without conscious thought, keeps track of how you treat it. It does not judge intentions or effort, it simply reflects reality. When your lifestyle supports stable blood sugar, fewer glucose molecules attach to hemoglobin, and HbA1c remains lower. When sugar remains elevated for long periods, more hemoglobin becomes glycated, and HbA1c rises, showing that your cells have been bathing in a higher glucose environment. This memory-like quality of HbA1c also teaches an important lesson about health. It reminds us that the body responds to consistency, not perfection. A single healthy meal cannot erase months of imbalance, just as a single indulgence cannot destroy months of care. The test reflects the gentle accumulation of habits, the silent power of repetition, and the way small choices, repeated daily, leave molecular footprints inside us. It invites us to think in terms of patterns rather than guilt, trends rather than panic, and long-term nurturing rather than short-term fixes, allowing us to see our biology as a living timeline that is constantly being written, erased, and rewritten with every passing day. Unlike fasting blood sugar or random glucose readings, the HbA1c test speaks in averages, and this is what gives it such depth and relevance to real life. Blood sugar is naturally dynamic. It rises after meals, falls between them, shifts with stress, sleep, illness, emotions, and even weather. A single reading can be influenced by what you ate the night before, how well you slept, or whether you were anxious that morning. HbA1c gently steps back from this daily turbulence and asks a more meaningful question. Over time, what has been the general environment inside your blood? By smoothing out the highs and lows, it reveals patterns that short-term tests often miss, allowing us to see the overall direction rather than isolated moments. This long-view perspective makes HbA1c almost philosophical in nature. It reminds us that health is not built in moments of motivation, but in routines that repeat quietly day after day. The body does not respond dramatically to one good choice or one poor one. It responds to what happens most of the time. HbA1c captures that truth with remarkable honesty. It reflects how often blood sugar is elevated, how frequently the body is under metabolic stress, and how consistently balance is maintained. In this way, it mirrors life itself, where outcomes are shaped less by extremes and more by what becomes habitual. For many people, this understanding brings relief. It means that one bad day does not define them, and one good day does not magically fix everything. It shifts the focus away from perfection and toward sustainability. HbA1c rewards steady effort, not intensity. A modest improvement maintained over months can move the number in a meaningful way, while extreme changes that last only days often leave little trace. This is especially important for older adults, whose bodies thrive on gentler, more consistent rhythms rather than sudden shocks. Averaging also brings clarity to decision-making. When HbA1c changes, it tells a story about what has truly been happening beneath the surface. It shows whether a new habit, medication, or routine is having a real impact over time. It filters out emotional reactions to daily readings and replaces them with evidence of long-term trends. This helps people respond with curiosity instead of frustration, using the information to adjust rather than to self-criticize. In a deeper sense, HbA1c teaches patience. It reminds us that the body operates on biological timelines, not emotional ones. Cells need time to adapt. Blood needs time to renew. Healing unfolds gradually, often invisibly before it becomes measurable. By reflecting the average rather than the moment, HbA1c aligns our expectations with the natural pace of human physiology, encouraging trust in the process of small, repeated actions accumulating into meaningful change over time. At a cellular level, elevated glucose is far more than a number on a report. It is a chemical environment that quietly shapes how tissues function and age. When blood sugar remains high for long periods, glucose begins to interact with proteins, fats, and even DNA in ways that were never intended for balance or repair. One of the most important processes involved is glycation, where sugar molecules bind to proteins and alter their structure. Over time, these altered proteins lose flexibility and efficiency, which affects everything from blood vessels to nerves. HbA1c serves as a window into this invisible world, offering a glimpse of how often the body has been exposed to this sugar-rich environment. Persistent glucose exposure creates a kind of metabolic friction. Blood vessels, which are designed to be smooth and responsive, gradually become stiffer and less adaptive. The inner lining of these vessels becomes irritated by excess sugar, triggering inflammation and oxidative stress. This does not happen suddenly or loudly. It happens slowly, quietly, year after year. HbA1c reflects the degree to which this process has been unfolding, acting as a proxy for long-term metabolic strain rather than short-term imbalance. At the same time, high glucose levels interfere with cellular communication. Insulin signaling becomes less efficient, forcing the body to work harder to achieve the same effect. Cells begin to resist the very hormone meant to regulate them. This resistance does not appear overnight. It develops gradually as cells adapt to constant exposure. HbA1c captures this adaptation process indirectly, showing whether the internal environment has been one of harmony or chronic overload. Nervous tissue is particularly sensitive to prolonged sugar exposure. Nerves rely on a delicate balance of nutrients and oxygen, and elevated glucose disrupts this balance by damaging small blood vessels that supply them. Over time, this can lead to numbness, tingling, or pain, often long before a person connects these symptoms to blood sugar control. The kidneys and eyes, which filter blood and rely on fine vascular networks, are also vulnerable to this slow chemical wear. HbA1c, though simple in appearance, reflects the cumulative exposure that drives these changes beneath the surface. What makes this understanding powerful is that it reframes prevention. HbA1c is not just about diagnosing disease, It is about recognizing an environment before damage becomes irreversible. By indicating long-term glucose exposure, it offers an opportunity to reduce chemical stress on cells, restore healthier signaling, and protect tissues from gradual decline. In this way, HbA1c becomes a bridge between molecular biology and everyday choices, translating invisible cellular strain into information that can guide gentler, smarter care of the body over time. The HbA1c test also carries an unexpected message of compassion, one that often gets lost behind numbers and medical language. When people see an elevated HbA1c, the first emotion is often guilt, as if the body is accusing them of failure or lack of discipline. But physiology does not work in moral terms. HbA1c does not measure effort, willpower, or intention. It simply reflects how the body has been responding to its internal and external environment. In this sense, the test invites understanding rather than judgment, encouraging a shift from self-blame to self-awareness. A higher HbA1c is not an accusation, it is information. It is the body saying that it has been under a certain kind of pressure for a certain amount of time. That pressure may come from food choices, but it can just as easily come from chronic stress, poor sleep, hormonal changes, aging muscles, illness, medications, or genetic tendencies. Two people can live very different lives and arrive at similar HbA1c values, while two people living similar lives can show very different results. This variability reminds us that blood sugar regulation is deeply individual, shaped by biology as much as behavior. When HbA1c is viewed through this compassionate lens, it becomes a tool for curiosity. Instead of asking, "What did I do wrong?" the more useful question becomes, "What is my body responding to?" This subtle shift changes everything. It opens the door to exploration rather than punishment. It allows patients and clinicians to look at the full picture of life, including eating patterns, movement, emotional load, sleep quality, and daily routines, without isolating or shaming any single factor. This is especially important because sustainable change rarely comes from fear. Fear may spark short bursts of effort, but it often leads to burnout or avoidance. Compassion, on the other hand, creates space for learning and adjustment. HbA1c supports this process by reflecting long-term trends rather than daily perfection. It shows that improvement does not require drastic measures, but rather small, consistent shifts maintained over time. A slightly better meal pattern, a bit more movement, improved sleep, or reduced stress can slowly alter the internal chemistry, and HbA1c will eventually reflect that progress. In this way, the test becomes a quiet partner in health rather than an enemy. It allows room for imperfection while still guiding direction. It acknowledges that bodies are complex, adaptive systems doing their best under given circumstances. By offering feedback without blame, HbA1c encourages a gentler relationship with health, one rooted in respect for the body's signals and patience with its pace, reminding us that understanding is often the first step toward meaningful and lasting change. Ultimately, HbA1c sits at a quiet intersection between science and self-awareness, offering more than clinical information and less than absolute certainty, yet exactly what is needed to guide thoughtful care. It reminds us that the body keeps records even when the mind forgets, storing the effects of daily choices in molecular form. Every meal, every period of rest or exhaustion, every stretch of calm or stress leaves a subtle imprint. HbA1c translates those imprints into a form we can observe, making the invisible visible and giving us a chance to respond with intention rather than reaction. What makes this especially powerful is that HbA1c reflects the body's honesty. It cannot be persuaded by good intentions or short bursts of effort. It responds only to sustained signals. This quality aligns it with a deeper truth about health, that lasting change is rarely dramatic. It unfolds slowly through repetition, consistency, and patience. When HbA1c shifts, it is evidence that the internal environment has genuinely changed, that the body has had time to adapt, recalibrate, and move toward balance. There is also humility embedded in this test. It teaches us that we are not separate from our biology. The body is not a machine that can be forced into compliance, but a living system that responds to care, stress, nourishment, and rest. HbA1c encourages respect for this complexity. It reminds us that progress may be invisible for weeks or months before it becomes measurable, and that this delay is not failure, but physiology unfolding at its own pace. For many people, especially as they age, HbA1c becomes a guide rather than a goal. It helps shape decisions without demanding obsession. It supports reflection without fueling anxiety. By observing trends over time, individuals can learn how their bodies respond to certain foods, activity levels, sleep patterns, and emotional states. This learning builds confidence, replacing uncertainty with understanding and fear with informed choice. In the end, HbA1c is not just about preventing disease or managing a condition. It is about developing a relationship with the body that values patience, consistency, and awareness. It invites us to slow down, to listen, and to recognize that health is a long conversation rather than a single event. By respecting the slow intelligence of human biology, HbA1c reminds us that care, when sustained and compassionate, has the power to quietly reshape the future written inside our blood.